Last November, Adam Salling received an unexpected letter. It was about his wife, Krystyna. Krystyna has late-stage Alzheimer's disease. She can't walk or talk. It's difficult for her to eat or even sip juice without assistance. The letter was from San Diego Hospice. It was notification that after receiving hospice care for the past 6 years, Krystyna was being discharged because she was no longer dying.
That was very interesting. It would have been funny if it were not so dramatic.
Just 9 days prior to receiving that letter, Krystyna lost her ability to walk. The disease was forging ahead. The irony of the letter was not lost on Adam. He had witnessed his wife's slow decline, from strong and vital woman to a whisper of her past self.
The letter from hospice said essentially that she is no longer terminal. I couldn't understand that, because once a person is terminal, it's terminal until the end.
After 6 years of receiving weekly visits from a team of nurses and health aides, Krystyna was cut off from the government-paid service as San Diego Hospice, one of the oldest and most respected hospices in the country, scrambled to discharge patients who may not have been eligible for care. She was not the only patient discharged. There were more in her nursing home, hundreds more across the county. In total, San Diego Hospice reduced its patient population from 1,000 to just 400 late last year as it tried to get ahead of a Medicare audit and federal investigation questioning whether the people they were caring for were actually dying. Whether it was a matter of compliance, finances, or some combination of the two that led to the demise of San Diego Hospice is still unclear. But the experience has left Adam Salling questioning the rationale of the system and the integrity of the trusted institution that provided his wife treatment when she didn't need it and abandoned her when she needed it most. Because what is clear to Adam, each day that passes brings him closer to saying goodbye to Krystyna. Adam and Krystyna first met at a junior college in Germany. Both had been born in Poland, both landed in Germany as refugees with their families. Adam, shy and 3 years junior to Krystyna, didn't know whether he stood a chance with a young woman who already seemed so poised and ready to take on the world. School ended, and so did their brief romance. But they would meet again, this time in Chicago as young immigrants. Adam finally proposed, and the two were married. That was in December 1956. The next several decades brought with it a move to San Diego, new careers, and a daughter, Magda.
Life was very nice in Southern California.
Until 2003, Krystyna was diagnosed with Alzheimer's disease.
There was absolutely no indication that Krystyna was threatened by a disease, especially a mental disease. She was, her mind was very active, and she was a rather brilliant person.
Krystyna Salling remained in hospice until she was discharged almost exactly 6 years after being accepted. Whether she was ever eligible for care when she was first referred back in November 2006, and whether San Diego Hospice ever properly recertified her to remain in care, is at the heart of why the hospice is being investigated by the federal government.
Even then, she was not in a bad condition.
Hospice is under scrutiny nationwide. The federal government wants to know what's behind its soaring cost, $13 billion in 2010, 4 times what it was a decade ago. Add up the monthly benefits San Diego Hospice was paid for Krystyna's care over the 6 years, it totals more than $300,000. That's for one person. Dr. Doris Howell founded San Diego Hospice back in the 70s. She's the director emerita of the hospice's board. She says she knew taking on too many Alzheimer's patients for too long was causing a problem with Medicare.
I'm sure we admitted some Alzheimer's patients because they had other diseases that deserved treatment that we could treat and make their life more comfortable. But it's hard to throw them out.
She says Medicare warned them about the problem before.
We sort of looked at them and said, well, do you want us to, at 12 o'clock on 6 months, you want us to say to the patient, you're no longer eligible?
Former employees who spoke to the KPBS and iNewsSource investigations desk say the hospice accepted almost all patients who came to them for help over the years, at times stretching eligibility requirements. They didn't want to be named for fear of prosecution for Medicare fraud, but they say there was an unwritten policy to find a way to say yes. One doctor told us, "The intentions were really good. We saw all the suffering and pain, people who couldn't get into community resources. It could have been overreach." Adam spends 4 afternoons every week with his wife in the nursing home. He speaks softly to her in Polish. She is losing the ability to swallow, the final stage of Alzheimer's. Her doctor once again recommended hospice care. Weeks after being discharged from San Diego Hospice, Krystyna was accepted into care by another hospice provider.
She may die within weeks, or she may live more than 6 months. There is no way to tell.
Adam is writing Krystyna's biography and compiling her many essays and poems into a book. He wants people to know who his wife was: survivor of war, activist in the Polish-American community, student of history, someone who liked to take long walks around Miramar Lake but was just as comfortable traveling to Turkey on a lone mission to learn more about her father, mother and grandmother committed to raising strong women.
If nothing else, I would like our friends in the community to remember her.